Hello ladies. Pelvic pain during pregnancy. Common, but it doesn't have to be normal. Today I want to discuss in this video some ways to relieve pelvic pain during pregnancy. If you're new here, make sure to subscribe, and if you like the video, make sure you hit the like button. My name is Heather Marr, and I'm a pelvic floor physical therapist, and my goal is to educate women so that they can take the steps needed towards healing on this journey towards health. If you're like many other women during pregnancy, you're having pelvic pain. Up to 86% of women deal with this. But please don't believe the myth that this is common or this is normal and you have nothing to do. It may be that you have complained about it to a doctor and it was just dismissed, or you were talking with your girlfriends and they say, oh, that's just normal, you have to grin and bear it. You don't have to grin and bear it. There's actually a lot of things that you can do to help the pelvic pain. I want to let you know, continue to follow the care of your physician. This does not replace any medical advice or treatment. And if you're having a fever, vaginal discharge, burning, with urination or bleeding, please contact your physician immediately. As pelvic floor physical therapists, we work on posture, breathing, and movement. The same thing is normal through pregnancy. But your body is experiencing so many changes every day, you're feeling it. Your center of gravity is off, you're feeling unbalanced, everything feels a little bit more difficult each day as the pregnancy progresses. So what can you do about this? Again, posture, movement, and breathing. Get a Theraball. It's an amazing thing. 65 centimeters is the size of this one, and you want a fit that is great for you. So about a 90 degree angle from the hip, knee, and ankle. You don't want your hips lower than your knees. Put your Theraball in the corner, about 2 inches away. Again, like we talked about, safety is so important. Everything feels off balance as you progress with your pregnancy. Get in the corner, put this here. Start to do circles with your pelvis. Again, it's going to feel nice to get out of that pregnant posture that we always see, anterior pelvic tilt. Move in circles, tilt forward and back. Feel that stretch through your pelvis. Another thing is to take your body, your hips through a pelvic figure 8 pattern. Go back and forth. Reverse the pattern. When you feel kind of a stuck or tight, roll in that little pattern and movement and see if you can loosen up that pelvis. Posture, breathing. It's great to practice breathing on the ball. Try to get your ribs back down. Again, pregnant posture goes into anterior pelvic tilt and the ribs are flared. Or as Julie Weed PT says, your bell is rung. You're here, you're trying to breathe and you can't do it and you end up breathing from up here. So again, work on your breathing. Pull those ribs down. Try to get them back on top. I know it's difficult, but try to do it. The other thing is movement. Again, I love sitting here. Grab a partner, have them sit knee to knee, lock hands, and stretch your back and keep moving. Again, some of those movements I was describing earlier, work with a partner. And again, you can roll into, pull, and find those spots that you can stretch, and you can do it safely when you've got somebody else. Some other things that are going to be beneficial for pelvic pain during pregnancy is get into water. I love aquatic exercise. Even if you can just get up to water to about here, walk forward, backward, side, it takes the pressure off. The body weight is decreased by about 80%. And your body just thanks you. A lot of my pregnant women have said, oh, I just wish I could stay in this water until I deliver. Another thing is pillows, pillows, pillows. You may be saying, oh, I've got a body pillow. Great, use a body pillow and several more pillows. Make sure you're in a neutral position when you're sleeping at night so that your body is allowed to rest and recover and be ready for the next day rather than sleeping in a tense and tight position. Another thing to remember is keep your knees together, almost like you're wearing a straight skirt. Rolling over in bed, getting in and out of the car, make sure those knees are together. Anytime you separate excessively, you're at risk for kind of stretching and straining the pelvic area. So those are a couple things. If the pain is even more severe and you feel like you need more help, please go and seek a pelvic floor physical therapist. We're trained to treat during pregnancy. There's a lot of things you can do. We want to calm down the body, but we also want to strengthen it and keep it strong so that you can really enjoy these months of pregnancy. I don't want you just to grit your teeth and grin and bear it and push through the pain, and this is agonizing. I want you to optimize your time during your pregnancy so that you can enjoy this. Reduce the stress, reduce the pain, and again, working on your posture, your breathing, and movement. Those are key for decreasing the pelvic pain during pregnancy. Again, be sure to subscribe and check out some of the blogs that I've written at onesimplestep.today. Again, thank you for watching. My goal is that you have more freedom in your daily activities on your journey towards health. Have a great day.